Welcome to the 10th video of from the series Studying and Learning Skills for Undergraduate Medical Education. My name is Mohamed Hassan Taha. I am medical educationalist, director of the Medical Education Center at the University of Sharjah, and we are having this series of video to support undergraduate medical students and health science students in their learning process while studying in undergraduate as well as postgraduate medical education. Today's video will be about feedback and the importance of feedback in medical education. So why feedback is important in medical education and why this topic is important for you to learn about feedback, and it's important. Your learning in medical school depends on the practice. And while you practice, you need to receive advice from your educator, from your peer in your practice in order to either reinforce your positive practice learning or also to correct any mistakes. So feedback is for enhancing practice, corrections, and improvement, and it helps you at the end of the graduation or at the level of the graduation when you graduate from the school of medicine, dental medicine, and health science to become a safer practitioners and more confident. The feedback also helps you to avoid repeating mistakes, improving your clinical performance, and understand why you lost mark when thinking about the assessment. Bear in mind that marks could reflect achievement of learning outcome, could reflect, but feedback is very important to continue your learning process. Our session learning outcomes will describe the rationale for giving feedback, describe the process of giving feedback effective for lifelong learner, and also discuss the barriers of giving the feedback or receiving the feedback as a student in a good way. Let us start by defining the concepts. What is the feedback? Feedback is information describe your performance in a given activity that intend to guide your future performance at the same activity when you do this activity again. And the information about performance that help you to improve your next performance in the future. And it's focused on what you did before, compare what you did with the standard best practices, and what to do next. And what to do next depend on what you learn from what you are about what you are, and the feedback that you receive on your performance now. So I'd like you to take a screenshot or to stop this video and to reflect on this question. What is the last time you received feedback? What is the last time you gave feedback? And explain your or reflect on your experience with the two occasions when you receive and when you give a feedback. And feedback, sometimes as students, you may feel that feedback is uncomfortable because of many reasons. Because feedback actually it exposes our weakness, and we'll also talk about this personal experience and the psychology behind that in part of this video. Feedback also challenge our confidence, and sometimes we may receive feedback from senior clinician or senior colleagues. So those people looking at our weakness may also create some sort of being uncomfortable. It may be brief or sometimes blunt feedback also may be something that could not be comfortable to us. So it is normal to feel uncomfortable with feedback. And bear in mind that, please, learning often feel uncomfortable because in learning we step out of our comfort zone. And in order to understand this very well, let us try to explain this important window model called Johari window model. And the Johari window model is a model developed by psychologists Joseph Lutz and Harry Ingham. they describe how humans interact, and including the process of receiving feedback. In Johari window, we have 4 quadrants. Let us go one by one. The first quadrant is about open self, and about open self is information about you that you know and the other know, like your name, like your year of study, your background, and so on. The other quadrant is for blind self, and blind self, it is related to information about you that you don't know, but the other do know. The third quadrant is about hidden self, and the hidden self is about information about you that you know, but other don't know. And the last quadrant is unknown self, which is related to information about you that you neither know nor the other know. How feedback work? Let us go deep into this Johari window. Receiving feedback enlarge the open quadrant by reducing the blind spot. So receiving feedback here enlarge this quadrant. The receiver of feedback learns things about themselves of which they were previously unaware about this. And this applies to both to educators and to students. So this is the open area. When we receive feedback from other, the open self is enlarged, and the blind self, as you can see here in this figure, decreased. Also, self-exposure will also enlarge the open area by reducing the hidden area. And shared discovery with others, including other observations and self-discovery, also expand the open quadrants by pushing the open quadrants toward the second, the third, and the fourth quadrant of Johari window. And here is very obvious. So the first figure, under self-disclosure, the quadrant will be in this shape, and under feedback, it will be in this shape, and under the condition of self-disclosure and feedback, it will be here. And the more successful people with those with open area. And definitely, we should keep some area hidden from others, but the willing we receive feedback, the willing we being a good receptors and recipients of the feedback, the more growth that we can have in our career. So this is, in a summary, feedback enlarge the open area by decreasing the blind area, exploration by moving in this direction toward this area, and by disclosure toward this area. So through the feedback and disclosure, you can reveal more about yourself and others, and learn more about yourself from others. Why feedback is important? And what is the importance of feedback? Feedback is important because without feedback, mistakes will go uncorrected. And also without feedback, good practice will not be reinforced. The first important principles of feedback should be timely. We should seek as students timely feedback. Feedback should be descriptive. When we, as students or as educator, we give feedback to other person, it should be descriptive. We should describe the task, the activities, rather than the personality. It should be constructive. We should build on the positive and in constructive manner. It should be specific on it should be specific on a specific area that need enhancement. We should avoid generalization while providing feedback, and this is very important. We should be comment on a specific area that need enhancement, and we should not be judgmental while providing the feedback. It is very important to think about, in order to have a positive feedback experience, we should eliminate any barriers, uh, and we should think about the consequence of not giving the feedback in a good way. This barrier could be maybe time and place, not giving the feedback in the right time or right place. Knowledge, as the giver or as the recipient of the feedback, we don't have the adequate knowledge about what we are doing. Ability to do feedback with a little practice from educators and sometimes from the students. Different perceptions could be maybe due to different cultures, and also could be one of the factors. The consequence of not giving feedback, without feedback, mistakes go uncorrected, and good performance is not reinforced. So feedback is not only for bad performance, feedback is for both for bad performance and for good performance. In order to deliver, to give a feedback in a good way, we should follow a model or a framework for giving a feedback. And as a learner, also we should familiarize ourselves with these models. So now we will discuss the models of the feedback. The most common one is the sandwich model. And as you can see here in the right side of the screen, in the sandwich model, there is a positive feedback, then the constructive feedback here, and then a positive feedback again. So a sandwich model follow positive feedback, corrective feedback, and positive feedback again. And the purpose of using this model is to reduce defensiveness from the learner or from your colleague. So if you want to reduce defensiveness, you can use this model. And actually, this model makes criticism easier to accept. And it is common and simple model that we can use. So as students, you may hear that, for example, when you deliver a presentation, you did overall well, you need to maybe to structure your slides better, and so on. So and then end up with you receive another positive layer of feedback, such as your presentation was organized and so on. Keep up good work. So you receive the corrective feedback in between the two layers, the positive, the corrective, and then the positive again. So how to benefit from this sandwich model? Don't focus only on praise. We should listen to the praise. We should listen to the positive things, but with the intention to build on these positive things. It's very important to identify the corrective measure and corrective message that need to be considered, and corrective feedback. We need to focus on as a learner on the corrective feedback. And the key learning point here, usually in the middle. The second model, also commonly used, is abundant models. In abundant models, as educators, they ask the learner what went well, and then they tell the learner what went well, and then they ask the learner what could be improved. Then, as educator, they tell the learner what could be improved. So, what is this model? This model follows a fixed sequence. You say what went well as a learner. Then the faculty member or the tutor add a positive thing that you did not mention as a student. Then you say what could be improved. Then the tutor or the teacher also add suggestions to you what could be improved. And the purpose here is to encourage self-reflection and to create a safe feedback environment. This is very important purpose for this abundant model. And your tutor may ask, what do you think went well? What could be improved? So as a learner, we need to prepare for that. And how to benefit from this abundant model? You have to be honest to tell. And you have to be honest about your weakness and area for improvement. You have to show insight, personal insight, and don't wait for the tutor to say everything. Try to be proactive and talk about what you think that you did well and what could be improved. And bear in mind that reflection improve the learning process. And please go back and watch the video related to the reflection in this series of videos to, to, uh, to master these skills of reflection. After the second model, let's go to the third model, is called 1-minute perceptors. And this you receive this feedback in this way in clinical practice. And this model used in busy clinical settings, maybe while doing shadowing or bedside teaching, the clinical practice. And based on this framework, you make a clinical decision, tutor asks you why, general rules are taught, then strengths reinforced, and then error corrected. And the purpose here is to develop the reasoning quickly. So as you can see here, you have you get a commitment about what do you think is going well, what should do next, what maybe ask you about what lab or image to be requested, what else might be going on, and then you have proof for supporting evidence, and then reinforce what the learner do right or got right, and then correct mistakes, and then teach the general rule. So it is like this way of feedback, and in each step there is a rationale behind this step. So what it looks like for you for this 1-minute perceptor. Why did you choose that diagnosis? What support your management plan? Next time, justify your choice more clearly. And how to benefit from this 1-minute perceptor is explain your reasoning, accept quick corrections, and apply it immediately. And this feedback improve your thinking, not your memory. Another model used for group setting is called set-go model. And this often used in tutorial, in seminars, in group settings. And S for see, E for else, T for think, G for goal, and O for offer opportunity in the future. And typically, what did we see? You should talk about this. What else did you notice? What do you think? What is the goal? And how can we achieve it? Or how we can offer opportunity in the future. And the purpose here to encourage descriptive feedback and to promote deep learning. Also, we have and it's common in the tutorial, simulation sessions, briefing, group debriefing, and you benefit by participate activity. You learn from peer. You reflect on different approaches, and you usually group feedback multiplies your learning by listening from other students. This model is called R2C2 model, and it is very clear here. Rapport building, then exploring reaction and perceptions, and then exploring understanding of content, and then coaching for performance and change. This R2CT model mainly used after assessment, because as educators need to build rapport with learners, explore the reaction, as you can see here, and then review the content, and then plan for improvement following coaching and performance for performance gain. And the purpose here is to help to accept and use exam feedback in a good way. The sixth model is called ALOBA model, and AL for agenda-led. The learner define what they want feedback on, then align the session with their specific needs. Then outcome-based, that feedback is directly linked to the desired learning outcome or clinical goal. And for the analysis, the facilitators and learners analyze the performance together rather than just providing one-way feedback. It's very important for you as a learner also to learn about these models, because you may use it in your clinical practice with your peer, or also when you become educator. So what is these models? You identify your learning needs, you reflect on your performance, tutor add observation, and together you plan for improvement. And the purpose here, you put your needs at the center and encourage ownership of the learning. Now we'll talk about the positive and negative feedback experience. For the positive feedback experience, active listening is the key. You have to listen. And there should be mutual respect between you and the provider of the feedback. And when we are providing feedback, we should focus on a specific praise or criticism, and we should show genuine desire to help. As educators and also as the learners, we should show the provider of the feedback that we are benefiting from this feedback. It's very important to have a good time, spending good time for feedback. The negative feedback experience, including public humiliations, providing feedback in front of people, focusing on personality rather than the task to be done, one-way discussions, there is no active listening, lack of personal interest. If there is any lack of personal interest, then this will affect the feedback, and the feedback when it is too brief or too long. Sometimes feedback fail. Why feedback fail? Feedback fail when it's fake, when it is delayed, when it feels personal, when you ignore it, when it becomes when you became more defensive. So it's very important to take into consideration that ignoring feedback guarantees stagnation, not progressing in your learner progress. And also feedback fail. Sometimes students maybe do mistakes. Why with the feedback? So the common mistakes, student mistake with feedback, students often focus only on marks, not for their growing and for learning. Forget feedback, not take action point for future improvement. Some learners take feedback personally. We should not take feedback personally, and do nothing with it. Also ignoring. It's not. This will not help you as a learner to grow. So bear in mind that feedback has no value without action from us. And to receive feedback professionally, you receive feedback professionally when you listen carefully to the provider of feedback, when you don't interrupt. So this is related to active listening. When you ask more for clarification and for examples. When you receive feedback, always ask for examples from the provider, from your teacher, from your facilitator. Always clarify expectations, the expectations from your educator, faculty member, and tutor. And thank the provider of this feedback. This is a professional behavior of dealing with the feedback. It's very important to bear in mind that if we don't turn the feedback into action, we will not benefit from the feedback into action. So how to turn feedback into action? As a learner, after feedback, you should ask exactly what exactly should I improve? Why does this matter? How will I practice this? When will I review the progress? This is very important. After feedback, you should ask this question and you should write the feedback that you receive from your educator down. And action actually create the improvement. The take-home message from this video: feedback help you learn faster and safer. Different tutors use different feedback models. So for this reason, we explore the different models of the feedback. You can go back to the sections of the models and review the video. Discomfort is okay. It's part of the learning process. And your response determine the feedback value. So be active listeners while receiving the feedback, and show interest to learn from this feedback experience. Use feedback actively to improve academic and clinical performance. This is very important thing that need to be considered and need to be taken into consideration. Thank you so much for watching this video attentively, and look forward to see you in the next video, which will be about team-based learning.